Bulimia is a eating disorder. Bulimia is eating large amounts of food and then vomiting those food that they ate. Some people with bulimia often overeat foods. There are two types of bulimia, purging and non-purging. Purging is a self-inducing vomiting and abusing the use of laxatives. Non-purging is when the individual over-compresses for overeating by excessive exercising or starving themselves in the days following their binge sessions. Some common signs of bulimia are often softening and eroding the enamel, irritating soft gum tissue, staining on the linguals of the maxillary teeth, weakening of the teeth, which can lead to teeth fracturing, sores on their palate, and often decay on teeth. It is very important that you are going to the dentist every 6 months for a routine cleaning. The dentist might inform you to use mouthwash with fluoride in it. Fluoride will help restore the teeth from decay forming.
Our case study patient presents as a female taking an oral contraceptive 1 tab daily, Lexapro 10 milligrams daily. Our patient does use a vape pen and has a history of cold sores, fever blisters.
Patient did state that her gums bleed after brushing, and she does have frequent sore throat, and patient also flosses once every 2 weeks. Patient often brushes her teeth 3 to 4 times daily, and she uses a manual medium bristle toothbrush.
Our patient does have a history of cavities, and her last cavity was filled about 5 years ago. At this time, 2 cavities were filled. Our patient does not drink water, but she does use toothpaste with fluoride. She drinks soft drinks, diet, daily, and also drinks sports drinks, usually drinking these drinks one after every workout. She chews gum, Trident brand, 3 to 4 times daily. Our patient also stated that she does often feel that she has dry mouth, but does not use any aids to relieve this dryness. She states that she has noticed sensitivity to cold food and beverages, and also has a history of bad taste in her mouth. Your intro and oral exam, I found in your extra exam that you had trauma caused on the commissures of your lips, and those are the small folds on the left and right sides of your lips.
Yeah.
Have you ever noticed that before?
No, I mean, my lips are kind of dry sometimes, so I put like Vaseline there to help it, but other than that, I didn't really pay it no mind.
Alright, and in your intra-oral exam, I found that you have a slight amount of erosion on the tongue side of your top and bottom teeth. Have you ever noticed that before?
I was wondering why, like, the back of my teeth look the color they are, but just didn't think anything about it. I wonder why is that, you know?
Alright, so this could be caused by frequent vomiting. Do you vomit frequently?
I do it like maybe like 2 or 3 times a week. I do.
Okay, and what are the causes of your vomiting?
I guess like overeating, and then I feel bad for overeating, so I do tend to vomit it up after I eat it, so I feel bad.
Okay. Well, this could be a little bit of a concern, but we'll talk about that later.
Okay.
I also noticed that there was traumatic lesions on the roof of your mouth, more towards the soft palate, and also swelling and redness of the back of your throat. When you are causing yourself to vomit, do you usually use objects or your fingers?
Fingers, yes.
Okay, and that could be the reason for the traumatic lesions on the roof of your mouth, and also for the trauma and chappedness of the commissures of your lips.
Okay.
Also, during your intraoral exam, I found that you had generalized moderate gingivitis, and this is inflammation of the gums. So this could also be a reason, or is the reason, that you find that your gums bleed every time you brush. During your exam, I also found that your parotid gland was enlarged. While we are not sure exactly what causes the parotid gland to be enlarged, I do know that that is a symptom and sign of bulimia. Or self-inducing vomiting. Do you often brush immediately after you vomited?
I do, because I can't stand it. Like, I feel like my breath smells bad, so I feel like I need to brush my teeth afterwards.
Yes, ma'am, and I fully understand that you feel the need to, but when you do self-induce vomit, it's very important that you do not brush immediately after vomiting due to the stomach acids that are formed on your teeth. You want to try and just rinse your mouth out with water or mouth rinse, but do not brush. With your permission, I would like to refer you to a licensed dietary nutritionist in order to get your bulimia nervosa under control. The signs and symptoms that you have seem to be moderate, and I'd like to get this under control before you cause any
more extensive damage to your oral health and overall well-being.
Thank you.
I
appreciate
also
that.
believe that since you are already on an antidepressant or anti-anxiety medication, that you may possibly benefit from seeing a psychiatrist.